prostate cancer is very common. It's one of the most common cancers in men. Actually, maybe the most common cancer in men that is other than skin cancer. There are some criteria we use. Usually, if there is a family history, we advise the screening starting at age 40. I mean, prostate cancer is very common, but good news is that it can be treated and it should be diagnosed early to be treated well. PSA test is called prostate specific antigen, which means that it is specific to the prostate gland. Elevated PSA doesn't mean it is cancer, so that's the main thing. That is why it is not it is not the best test out there, but this is the best we have. We are coming up with other screening methods also, but PSA is one that gives you a baseline, what your risks are. PSA is a basic tool, but there are other things that we also utilize. It is a blood test, and it can be done anytime. You don't have to be fasting for it. The only thing is that you should not have sexual relations like ejaculation for about 24 hours before. It is also very important to understand that PSA can be elevated in infection or in enlarged prostate. So people who have infection and the PSA is very high, they get scared, hey, it's too high. So treat with antibiotics, repeat the PSA, it should be back to normal. Basically, a urologist treats ailments of the urinary tract. That starts with the kidney, bladder, prostate, urethra, testis. The only thing we don't treat is kidney failure, which is dialysis, or medical kidney disease. That is treated by our brothers who are called nephrologists. Okay, so that's the only, otherwise we treat every other urological condition. And I think the prostate cancer is very common cancer that involves the men. The incidence is increasing, but it is also becoming more treatable, which is good news. Usually we treat prostate cancer, but before we even treat, we have to first make sure that we diagnose it on time. This is very important. We advise screening process to start at early age, but especially for people with family history. PSA alone sometimes doesn't diagnose, and there are other tests that are maybe used in addition to PSA to diagnose prostate cancer. Then depending upon the stage, you treat the prostate cancer.